Hi everyone, good morning, good evening, good afternoon, wherever you're joining us from. My name is Eunice Owino. I am the founder of Sickle Cell Trust, where our aim is to educate, advocate, and we want to eradicate sickle cell in Kenya and also the rest of the world. So, Sickle Cell Trust is an organization that was formed over 10 years ago, that's a decade ago. And all this started from my personal journey. I remember 10 years ago, I had to leave my work because I had to do a total hip replacement, which was caused by avascular necrosis or AVN, which is one of the side effects of sickle cell disease. So going through that challenge made me realize that I have never shared my story. And a lot of people who are born in the 80s like myself never used to talk about sickle cell the way we are doing it. And for the past 10 years, advocacy has been the key, awareness has been the key for people to just learn and manage how to live positively with the disease. So our aim is usually to just address the issues of sickle cell, to educate the patients like myself, also their caregivers, also their spouses, also the people who take care of us like our healthcare providers. It's important that we educate our healthcare providers for them to also understand how to care for us bestly. So beyond us just having an organization, our uniqueness in our organization is because we aim to educate especially the adult warrior, meaning the person who is an adult 18 and above and have sickle cell. Majority of them are usually thrown out of the house to start looking for work because now they are adults. And don't forget the myths around sickle cell where we were being told we can't reach certain ages. But right now we have seen people live even past 100 years living positively with sickle cell. So sickle cell does not limit you. Sickle cell is not a death sentence. Sickle cell is just like any other disease that you might have or you're being born with, because don't forget it's an inherited disease. So our key, just going through the tenure that we've been around and just going back and just to give you some of the key highlights that we have done for the past 10 years. We started by taking photos because we believe when we take a photo of you, a photo says 1,000 words. So that's how we started taking photos through a whole group of patients, including one lady who taught us how to do advocacy because I was so green and never knew how to do advocacy. But my friend and I, we were able to learn, we were able to go through an apprenticeship to just also learn how to do advocacy. So how we used to do this was by taking photos of the patients and tell their stories. So from there, then we grew and we started to do support groups. We started creating manuals to educate people. We started creating awareness and we started using, that is also the time Google was very key. We started Googling around about sickle cell, World Sickle Cell Day, what is the sickle cell month for creating awareness, which is September. And again, just Googling again other organizations who are doing the same thing we're doing. And what is the unique thing that we can bring on the table. And through that, we've been doing a lot of awareness and education. Over the past 10 years, those are the key things we've been doing. We've been partnering even with Google. There's a time we partnered with Google, I believe that was in 2017. We partnered with Google. We were able to train the adult warriors how to make money using Google to train them, give them that knowledge. But now you see everybody's earning. After COVID, everybody's earning from Google and all the other social media handles or system people are using to just manage themselves. We also have support groups where we meet every month or quarterly depending on also activities that we're doing per month. So our support groups has been a place of, we call it a safe space, where you come in, you can talk, You can tell us what's going on with you, how can we help you, what advice do you need, is it relationship, is it how to look for a work, or is it mentorship? Because also we are very keen when it comes to mentorship. And then also we have partnered with different hospitals and also universities to again do a lot of research. And that's why it's important when people are coming in and they want to do a research for a drug, we always try as much as possible to educate you as a person so that you can know where the education comes from and also how to make sure that you understand which kind of clinical trial you're entering into, what you're supposed to know, and after the trial, what happens. So those are the research, we call them research initiative that you're going through together with other partners for you to understand before you go into any research that is coming to our country. What does it do to your body? What kind of drugs are they looking for? And then again, outside our Kenya, how many other people are on the same research and what does it entail for you to be able to give in your wages? So it's important for you to know everything. We also are very keen community engagement. We engage the community a lot, especially during World Sickle Cell Day, during the Awareness Month. And also we try as much as possible to make sure that every month we do something in all the 17 counties that are heavily burdened with sickle cell disease. So our footing as SCUT, we are everywhere in this country, just again to educate people about sickle cell. When it comes to healthcare partnership, we partner with a lot of healthcare hospitals where we try as much as possible to have clinic days for sickle cell, which usually depends with the hospital. Others are on Tuesdays, where we have a sickle cell clinic. Others on Monday, others on Friday, where it's tailor-made specifically for sickle cell patients. So it's a day where you go in, you get your care, you get your checks, you go through also counseling, because it's important also to do your mental health with sickle cell. We do also legislate and advocate for policies to pass. Like through this work, we've been able to make sure that we have our clinical guidelines for sickle cell. Last year we were able to launch the policy for newborn screening, and again we're trying to see what other policies that benefit us as patients, especially at the workplace and also the community level and also the society, how they're supposed to take us. So this year, as we were marking 10 years, we were able to do our fundraising. And our fundraising, we were aiming to support 100 patients, but unfortunately, we didn't reach the amount we needed. Now we can be able to only support 16 patients with medicine. So that's what we'll be doing on the 14th of December. And that will be our last event for the year. And also soon we'll start publishing our books, our diet book, which I've been writing for the past 10 years. So next year, that will be something for you to watch out. We'll be launching and publishing a lot of books, resources that you need. We'll be sharing your stories on this channel. So continue connecting with us. And we have a lot of annual events that we'll be doing next year. This year, our first annual event was the fundraising dinner. Next year, we want to do a run and many other things that we want to put in place. So continue following us, continue subscribing, and also just to see some of our achievements is we keep on rising in numbers. We keep on mentoring a lot of patients like you out there. So we ask you that you continue to support us so that we support many other people. And this Christmas season, we want to wish you a Merry Christmas. And as you celebrate Merry Christmas, we ask you that you adopt a sickle cell warrior. What do we mean when we say in our website that support a warrior? It means when you support this warrior, you take care of their medication for 1 year, you take care of their health insurance for an entire year. So please join us, share, like, follow, reach out to us in any of our social media handles, and we'll be able to support the sickle cell community that we have in Kenya. From us to you, we wish you a Merry, Merry, Merry Christmas and a Happy New Year. And don't forget, we are here because of Jesus, and Jesus is the reason for this season. And being Him, we are celebrating Christmas because of Christ. So be a Christ-like ambassador out there and support a sickle cell warrior. Thank you.